Namaste and thank you for asking me to talk on this topic of post-stroke rehabilitation. So as Dr. Dhamija mentioned earlier, there is an increase in life expectancy in India. And with this, there's an increase in age-related diseases like stroke. Stroke is one of the leading causes of death and disability in India and worldwide. So there are two types of strokes. The more common one is ischemic stroke, and the other one is hemorrhagic stroke, or what is more commonly known as brain hemorrhage. In ischemic, stroke is basically a disease of the brain arteries, and what happens in ischemic stroke is that a clot forms in one of the arteries to the brain and obstructs the flow of blood through that artery. So as a result, a particular part of the brain is deprived of blood, and that area gets damaged or dead. That is called an infarct. And the particular function that part of the brain carries out is lost. In a brain hemorrhage, it is similar. There is a diseased artery and the wall of the artery is weak, and that ruptures, most commonly because of high blood pressure. The blood oozes out and collects in a particular part of the brain, and again, the function that part of the brain carries out is impaired. So 85% of strokes are ischemic and the remaining are hemorrhagic. And what is important is to know how to recognize the stroke, because the quicker you act, the more the chances of saving brain tissue. The important thing to know is that stroke symptoms come on all of a sudden, and there is a mnemonic that is there to help you recognize a stroke. It's called B fast. So B stands for balance, which means there could be a sudden loss of balance. There can be sudden visual impairment. It could be in one eye or both eyes, or it could be double vision. There can be sudden weakness of one half of the face or a drooping of the face. Sudden weakness of the limbs, commonly of one arm, but it can be one half of the body or sometimes all four limbs also. There could be sudden difficulty in speaking or slurring of speech. And T stands for time, because time is very important where a stroke is concerned. The sooner you get treatment, the more the chances of saving brain tissue and reducing death and disability. So it's said that time is brain. For an ischemic stroke, the one that happens because of clots in the brain, the first 4.5 hours is considered the golden period. This is the period where if you take timely treatment, there is a particular injection that can be given to break the clot and reduce disability. Even beyond 4.5 hours, for the first 6 to 12 hours, in a few cases, sometimes the clot can be mechanically disrupted. So the bottom line is that you should try and get treatment as soon as possible when you recognize a stroke. In brain hemorrhage also, within the first 24 hours, the bleed tends to increase in size, and there can be related complications. So the sooner you get treatment, the better. Delay in recognizing or treating the stroke means that there will be greater damage to the brain tissue. It could reach a stage where that particular part of the brain becomes dead, and there is more residual disability. Once the brain tissue becomes dead, there is no medication to revive it or bring it alive again, and the disability may become permanent. So that is the importance of getting treatment on time. The common disabilities which are seen in stroke can be paralysis of the limbs. So it can be one limb or all four limbs, but the most common type is paralysis of one half of the body. There can be facial drooping or weakness of one half of the face, speech difficulties, swallowing difficulties, visual impairment, imbalance, and a paralyzed limb can become stiff, especially over time. These sort of disabilities can happen in other neurological illnesses also, but with a stroke, the symptoms will come on all of a sudden. However, improvement will be very slow. And in a few people, the recovery could be complete. In some, there may be no recovery. But in majority of the people, it will be a partial recovery. So although people with stroke have residual disability, all is not lost. The treatment focuses on the initial period of the stroke, but even when that period is over and there is some residual disability, that is when the role of neurological rehabilitation comes in. Rehab focuses on reducing disability and limitations on activity. The aim is to increase the independence of the patient and to reduce their burden on the family and society, and basically to improve quality of life. The sooner one starts rehab, the better. In fact, some people start on day 1, but definitely by day 2 of the stroke. And it's been seen that early physical therapy and mobilization prevents many complications. So I'll just mention some of the complications that can happen if you don't do physical therapy and rehab. One of these is stiffness. The paralyzed limb can become stiff, and if no physical therapy is done, the stiffness increases gradually, and it can come to a point where it becomes permanent when it's called a contracture. So the limb becomes deformed, it will be held in a particular position. Like you see in this arm, there is a permanent contracture at the elbow and the wrist joint. Here there's a contracture of the knee and the hip joint. And when it reaches the stage of contracture, even physical therapy will not help. So we don't want it to reach this stage. At this stage, only surgical release would help. The other thing that early mobilization helps is it prevents bed sores. Bed sores happen because of friction of the skin against the bedclothes. And this is just a mild bed sore, but sometimes they can be very deep ulcers, they can get infected. And the earlier you mobilize the patient, the more the chances of preventing such sores. Swallowing difficulty is a very common thing that happens with a stroke. The good thing is that swallowing difficulty tends to improve over time. Often a paralysis will not improve that much, but swallowing tends to improve. So what happens with a stroke is that when a person swallows food, it goes, in a normal person it will go into the food pipe, and there is a particular valve that acts and prevents the food from going into the windpipe. But when the swallowing mechanism is impaired, as in a stroke, this valve does not work so well, and the food can go into the windpipe and then into the lungs and cause chest infection. So physical therapy can help with this also. Swallowing exercises are taught to the patient to prevent such infections. Rehab is done by a multidisciplinary team, and at the core of the team is the patient himself or herself, and caregivers to the patient. In the initial stages, doctors and nurses are important because they have to deal with the medical aspect of the stroke and stabilize the patient. But as time goes by, the role of the other members, they are the ones who take the lead. So the physiotherapist is very important. They are there from the beginning till the end of the rehab process. Occupational therapist, orthotist, we'll talk about all these a little later. The speech therapist teaches speech and swallowing exercises. Ideally, there should be a recreational therapist also, because when you involve the patient in recreational activities, it improves their the emotional aspect and makes them feel that they are getting better. And you can understand that psychologists and dietitians may be needed. Social workers are often needed to find out the family issues which are impeding the rehab process, and sometimes financial issues also, and to deal with those. So rehab starts when the patient is still in the hospital as soon as possible, and then when they're discharged, community-based services take over. These are cheaper, and it's also emotionally better for the patient when they're doing the rehab in the presence of their family members, where encouragement plays a big role. So the process of rehab is, initially you set goals for the patient depending on the severity of disability, and every stage you have to motivate and guide the patient, and this has to be done by every member of the team. Exercises are practice is encouraged for exercises, and the level of complexity is gradually increased. compensatory techniques are taught to deal with the disability, and at all times you have to ensure that safety of the patient is maintained. Then after a particular period you reassess and see what progress has been made. That itself also motivates the patient, and you see what are the impediments that are occurring to the rehab process, and you set fresh goals depending on how much improvement has occurred. And family and social support is extremely important at every point. So I'll now request the aim, basically I wanted to show this is that from a person with disability you want to try and reach a stage where the person is as independent as possible so that they have a good quality of life. I'll now request the therapist to tell us a little more about the exercises.